Hi everyone and welcome to Sydney. I'm speaking to you from the land of the Gadigal people of the Eora Nation and want to pay my respects to elders past, present and emerging, and really acknowledge the leadership of First Nations communities and services in person-centred care. We're really sorry not to be welcoming you in person, but I'm delighted to be speaking with you today. And I get to share a peek at some of my favourite parts of Sydney and New South Wales. So when we last met in Ottawa in 2019, I spoke about how health justice partnerships were emerging in Australia and the opportunity they present to take a broader lens on the value of legal help. To recap, health justice partnerships embed legal help in healthcare settings and teams to support clients experiencing health-harming legal issues. In Ottawa, I argued that describing the value of legal help in language beyond access to justice allows us to speak about what this work offers to a much broader audience. I made the link between the work of lawyers and health outcomes for patients and health services. I spoke about health justice partnership as a legal assistance strategy and as a health strategy, with a focus on what collaboration between sectors offers each over and above their siloed services. Since then, the number of health and legal services coming together in Australia has increased, as has the interest of health services in the value of legal help. So today I'll update you on Health Justice Partnership in Australia, first as a legal assistance and health strategy, and second as an interdisciplinary learning opportunity. I'll reflect on the impact of COVID as a very real challenge, but also value the sharp focus it has given to the health impact of social inequity and as a catalyst for change. But first, let me set the evidence and policy context for Health Justice Partnership. As this audience well knows, 2 decades of legal needs and access to justice research globally has fairly consistently pointed to the concentration of legal need among those experiencing disadvantage, the clustering of legal problems, and their intersection with other life and health issues. The range of barriers to taking action about legal issues is also well known. When action is taken about a legal issue, we know that help may be sought from a range of sources other than lawyers, including health services. But even when help is needed but not actively sought, legal issues can manifest in health settings as factors that affect patients' health and well-being. An example in our work, midwives and maternal and child health nurses are in contact with women at a time they are very vulnerable to family violence. With training and trusted connections, these health professionals can help identify violence and related legal issues and link their patients with trusted legal help. Responding to access to justice evidence, global, national and jurisdictional policies promote services and systems which are person-centred or client-centric. Features of personal client-centred justice services are that they are targeted to the most marginalised by their needs and circumstances, with a view to increased equity and access. They are timely, with a view to preventing the escalation and recurrence of legal issues. They are appropriate and responsive to individual need, and they are empowering through a focus on building legal capability. And they're collaborative and integrated. The OECD also refers to person-centric services as being grounded in empirical evidence around legal need and capability, outcome-focused and effective, with a focus on learning and developing and sharing best practice. And these last 3 points identify services as part of a continually evolving evidence base, both drawing from and contributing to what we know. And this is particularly pertinent at this time of change arising through COVID, where we're having to adapt, respond, test and learn in new service environments. Person-centred approaches are of course very common in health policy and practice and offer a point of connection between legal assistance and health services around shared client groups disadvantaged by intersecting need. And so it's in this context I turn to Health Justice Partnership. Health Justice Partnership is an opportunity to coordinate efforts to address the intersecting health and legal issues that can lead to an entrenched disadvantage. As a person-centric legal assistance strategy, Health Justice Partnership is consistent with the criteria listed above. For health services, legal help is a tool to address factors beyond the medical that are affecting patient health. Broadly speaking, Health Justice Partnership commonly involves legal assistance to individual clients within a healthcare setting or team. In our work on outcomes, we're exploring client wellbeing as the shared measure of this part of the work. Health Justice Partnership involves the transformation of practice and service systems through interdisciplinary training, secondary consultation, and collaborative practice. And we're particularly interested in increased health and legal practitioner and service capability to address intersecting need as an outcome of this change. Some HJPs are also involved in shared advocacy for changes to law, policy, and practice that can impact on health and wellbeing more broadly. On the ground, health and legal services actually partner in a range of ways, from outreach clinics to integrated services where the lawyer is actually employed by the health service, to multi-agency service hubs and formal partnerships. And together we refer to this as a health justice landscape. Our current assessment is that there are more than 100 services on this health justice landscape in Australia. However, there still is a degree of flux in these numbers after many partnerships ceased on-site services during the height of the COVID lockdowns. Services are also still reshaping their partnerships and ways of connecting with their clients and with each other. And these new ways of working and connecting, including online, are in turn challenging our understanding of what it means and takes to partner for person-centered care. And I'll return to the specific impacts of COVID in a minute, but first want to give you an overview of the landscape here. Broadly speaking, the vast majority of legal partners are public legal assistance services, so legal aid commissions, community legal centres, and Aboriginal and Torres Strait Islander legal services. The sites include hospitals, community health services, maternal and child health services, mental health services, and Aboriginal community controlled health services, among others. In terms of clients, HJPs are reaching and assisting clients with high need for legal assistance services. So lots of legal issues and challenges with reaching legal help. In particular, those experiencing domestic and family violence and mental health issues. Importantly, these clients are not only seen in HJPs that target those particular needs, but across the landscape of partnerships, both specialist and generalist. As discussed earlier, health justice partnerships provide an opportunity of health and legal services to work differently around complex need. Compared to legal services in standalone locations, the activities that partnership enables include secondary consultations, where professionals can consult with each other about a shared client or issue, capability building through the interdisciplinary training and just the shared practice of working together, and collaborative health and legal care around clients with complex issues, such that each service can play its part in support of and supported by the other. Acknowledging that Australia's fared incredibly well so far through COVID relative to others globally, major impacts here have been the lockdowns, the often sudden border closures, service closures, and of course economic issues arising. Impacts on people's mental health and increases in family violence have also been of key concern. In terms of service delivery, we've heard from our network of practitioners that partnerships have been better able to maintain services when they have strong existing relationships, inclusive of effective referral and communication pathways, and a sense of shared ownership of the partnership, often with shared governance. In other cases, there have been fewer secondary consultations, fewer referrals, fewer team meetings, and a sense that it's been hard to keep the partnership alive or thriving. Challenges to service delivery through partnership have included health services needing to pivot and prioritise the immediate COVID response, clients no longer coming into health services in person or at all, and lawyers, of course, not being able to work on site. So there was less scope for health and legal practitioners to engage with each other around their shared clients. The move to online or phone-based service delivery to clients has had positive and negative effects. More flexibility, for instance, but also the risk of excluding some clients. We're still exploring what partnership and connection will look like as we live with COVID-19. What is genuine collaboration beyond co-location in the digital space? And we're exploring how to maintain connections, not only between clients and services, but between the partner services. So I've spoken a bit about the challenges COVID has presented in terms of maintaining services and partnerships. But in discussing health justice partnership as a site of learning, I'd also like to reflect on the opportunities presented through COVID, as difficult as it has been. Necessity has seen opportunities and openness to new ways of working and connecting. An increased recognition of and investment in addressing issues such as economic loss and mental health and family violence that do intersect. And a greater sense of how these issues intersect and how solutions to these issues require an integrated response. Foundational work between Health Justice Australia and Health Justice Partnerships now situates us in a really good place to take this opportunity and learn more about the practice and value of collaboration in this new world. Our early research has explored what partnership looks like across the health justice landscape to identify the common activities and features, as well as how services differ. As we gather information about outcomes from different partnerships, we aim to identify how different features and activities contribute to and challenge effective practice and outcomes. To identify outcomes, we've worked with a number of HJPs and researchers to co-design an outcomes framework for health justice partnership as a legal assistance and health strategy. And we've been asking about what legal services gain from working with health, why health services partner with legal services, and their shared value for clients that they hold at the centre of their work. Our theory of change identifies 5 beneficiaries of health justice partnership: clients, clearly, but also practitioners, partnering services, funders and government, particularly those interested in complex need, and communities. And we're exploring shared metrics for these outcomes with a particular focus on client wellbeing, recognising where person-centred care of health and legal services together had a shared impact. We're interested in the wellbeing for practitioners, particularly in the context of the impact of COVID, client capability and empowerment, and importantly, practitioner and service capability to more effectively address intersecting need and as a site of longer-term service system change. We're looking to pilot measures in existing and emerging partnerships and are keen to work with others to do so. We are also looking to bring services together into a large multi-partnership study, which will nest a number of sub-studies: a data linkage study to explore health and justice outcomes and wellbeing, an analysis of the features of partnership and partnering, particularly in this changed service environment, and a study on the impacts of partnership on practitioner and service capability for person-centred care. So if your service is part of an HJP and you're interested to participate, please get in touch. Recognising the foundations and leadership of the HJP movement in Australia by legal practitioners, HJA has been championing this work with health services. 2 papers to support that advocacy are on the slide. And we are seeing real interest expressed by health services in the opportunity to embed legal help in their service strategies, to help address the social issues impacting upon patient health and treatment, and to build the capacity of their practitioners and services. To test and learn more about this way of working, the study we're involved in on the impact of childhood adversity on mental health is one example. Indeed, the most recent federal budget in Australia has identified the intersection between health and legal need, particularly around mental health and family violence. Funding to health and legal assistance sectors around these issues provides even greater scope for services to partner across sectors to provide person-centred care for the shared clients with this intersecting needs. It's also an opportunity to explore questions such as what impact does legal help have on health outcomes, and who else might invest in this work? What are the costs and benefits of collaborative or partnered services? And post-COVID, what does collaboration compared to siloed service delivery look like in a partially online service delivery context? So summing up, COVID-19 is shining a harsh light on the intersected nature and impact of health and social inequity. It's also challenging the way we respond to these issues, but also presenting new opportunities and, I would argue, new incentive to work collaboratively through strategies including health justice partnership, and to test and learn as we do so. So thanks for your time, and I really look forward to discussing all of this when we meet. Thank you.